Good morning, everybody. My name is Katie, and I am a PGY1 pharmacy resident. If you are new here, welcome to my channel, and today I'm going to be showing you a day in my life on my oncology rotation. So I get up around 5:45 in the morning, I brush my teeth, and then get dressed in my scrubs. I then do my hair and put on my facial sunscreen. And for breakfast today, I'm just having a bagel with cream cheese. I then put on my shoes and head out to my car. It's quite cold in the morning, so I have this frost guard on my windshield to prevent that from freezing up and taking forever to defrost and just wasting a lot of time sitting in my car. I then walk into work, and since it's winter, it is so dark outside, which is kind of sad, but after putting my belongings in the pharmacy, I head up to the 3rd floor on the west side of the hospital to begin my oncology shift, which starts at 7 a.m. So on the shift, we cover our inpatient oncology floor, which consists of about 40 patients, but that can really change. We also have an outpatient oncology center, but that is a different rotation. This is the inpatient oncology. And so I will note that not all of these 40 patients do have active chemotherapy, but they do have or had some kind of cancer diagnosis, so that's why they are on the oncology floor. But in the morning, I run reports to determine upcoming inpatient chemo plans and see if there's any that I need to prepare for today. If there are some scheduled for today, I would look at their expected admission times so that we know when to have everything ready by. I would also look at their cancer diagnosis, treatment, regimen, and line of therapy, as well as any previous therapies that they've gotten, relate that to the NCCN guidelines and kind of understand why they're getting what they're getting. And then I would verify the orders while looking at guidelines just to make sure that, everything matches up, and that does include supportive care as well. But that would be once the orders are actually signed by the oncologist. That's generally what a typical workup would include. We can have as few as 0 active chemos in a day. And the most that I've had on this rotation, I believe, is 4. Though I did hear from the main oncology pharmacist that it did go up to 13 recently one day for her, which must have been absolutely crazy. But I try to take my lunch somewhere around noon to 1 o'clock-ish. And so I went down to the cafeteria and had beef stroganoff. But back to the rotation, one thing that I love about this rotation is that my preceptor really had me focused on the oncology patients, because I feel like a lot of the other acuities that we do are very similar across other floors, so I really liked that I got to take a deep dive into these patients and kind of take advantage of that in this rotation. So I did many topic discussions and presentations during this rotation, such as TLS, metastatic melanoma, and prevention of cancer-related infections. I also discussed all of the oncology patients and their different cancer types with my preceptor as more of an informal topic discussion to better understand treatment regimens and their side effects, which was pretty neat that she took the time out of her day to, go over all of that with me. And some highlights of this rotation, I would say, include the fact that the oncologist sits on the floor next to us, so we can easily ask them any questions about a patient's treatment. We also have pretty close interactions with nurses, and I've had plenty instances where they've come up to me and asked me questions, which is pretty cool too, just having that face-to-face interdisciplinary interactions. And then it was also neat to be able to manage complex multiple-day regimens, such as TIP, and be able to follow up on any side effects and management for those side effects. So the shift does end at 5:30 p.m., and so at that time, I head back to the pharmacy and grab my belongings and look at this pretty sunset. The good thing is I get to see pretty sunsets, so I appreciate that. But then I drive home and put my windshield cover on my car for the next morning, take a shower, put on my moisturizer, and tonight was a little atypical in the sense that I had a friend who came over and brought pizza. So we just hung out and ate and talked, but I didn't really film any of that, so there's the pizza. I also had an orange for a snack too, so that's what this is doing here, but I then brushed my teeth, and then I went to bed around 10:30 p.m. and then repeated it all again tomorrow. So that's it. Thank you for watching. I hope you enjoyed it, and I'll see you next Sunday for another video. Bye!